Okay.
We're calling this WWDCD. What would Dr. Choi do?
What would Dr. Choi do?
This is perfect. I'm assuming you have the CareNotes app on your phone.
I do.
We're going to be in a scenario where I actually am your patient. Dr. Choi restored my smile.
Yes.
Hello, number 5. And
how's that 5 doing, by the way?
Oh, it's perfect. You can't even tell.
Okay, good.
Oh my gosh, my teeth. I want to do something else, but I'm just like, I think I'm just being like too much.
Yeah, no,
like my smile is really perfect.
We'll get you in.
Yeah.
So yeah, as you can see, this is the main recording page. So in New York State, there's what's called a one-party consent law.
Okay.
So if you and I in a conversation, I can hit record without you knowing. That's legal.
Really? That's legal.
But let's say if we have a third person, not in the room, having a recording device in here as we're talking, that's illegal, of course.
Okay, gotcha.
So
without my consent.
That's the law for most of the states in the US. So
thank you for clarifying that.
Yes, but of course, us doctors, we can build it into the consent form in the patient registration form. So it's all there.
Okay.
So yeah, how should we? You want me to just...
I'm just going to walk in. Hey, Dr. Choi, how you been?
Oh, doing good, Valerie.
Okay.
How you been?
I'm good. Okay, so I feel like there's this black spot on the back of my tooth, and my tooth is shifting out.
Okay.
And then I also kind of want to do a gingivectomy.
Okay.
Because I feel like I have a gummy smile.
Yeah.
But I don't know if I should have Botox on my lips to like keep the smile. I don't know. What do you think?
Yeah, well... First, let's talk about that black spot.
Okay.
So you're saying black spot, is that on the tooth or your
It's between my teeth because I'm a horrible flosser. And I had a filling there and I think it chipped. But it hurts sometimes. But food gets stuck there, but not all the time.
Okay. Is it sensitive to cold?
Sensitive to cold sometimes, yes. And sweet.
And sweet.
Yes.
Okay. Yeah, let's maybe a filling chip there and you're seeing a void that's dark, catching the staining.
Gotcha.
But we'll take an x-ray. We'll make sure it's not too deep. We'll do a clinical exam and confirm.
Thank you, Doc.
Now, as far as your gummy smile, as you say, so the Botox is one option where we do a couple injections on the upper lip so that as you smile, it doesn't contract as much and the muscle's a little weak and it can cover the gum more. But that effects only last about 4 to 6 months.
Gotcha.
That means if you want to have that smile and maintain,
I got to keep it up.
Yeah. So, that's a consistent Botox, which is fine. But I think a better option would be doing some gingivectomy, we call it, where we reshape the gum line with the laser. You're numb, you don't feel anything. And that way, your teeth, I'm just doing a quick look and I see the ratio, I think the teeth can use a little bit more of a height. Okay. So if we do a gingivectomy, you'll be able to see more of the tooth height-wise and it'll look a little more natural.
Yes, Doc, because I'm trying to get proposed to this year and I need to be
make it happen.
Right. I need to be bride ready. So I need you to fix my smile.
Yeah.
So other than that, do I have any other treatment? What's my next, what should I do next?
Yeah. So, I'll write up the whole treatment plan. Looks like this upper left looking at the x-ray. There's a little filling we need to do. So we'll start there because that's important.
Got it.
And then our team on the way out will go over the whole treatment plan with you, all the coverage, so you know what to expect. We don't like surprises.
Yes.
And then the gingivectomy, that's as long as it's before your big wedding day, I think we'll be okay.
Awesome.
And look at all the factors. And when you're ready, you just let my team know at the front. And we'll get things going.
Perfect.
Yes.
Thank you. End scene, everybody.
All right. So should I stop the recording and let's see how it came out.
This is so cool.
Okay. So you see, I just hit stop and then you see that little wiggling button there, little menu.
Yeah.
You hit that. And then on the top, it should be generating. You see that little progress.
Oh, wow. This is so cool.
It's spinning. Wow.
This is cool.
And
look, everybody, it's working.
You'll see a green note there.
Oh, green note.
So hit that.
And whoa.
Let's see. So I always put my side note, the personal note on top. So let's see how it came out.
So it's broken down, y'all. So it says side note. Patient expressed concerns about a black spot on the back of a tooth, shifting teeth, and a gummy smile. She mentioned sensitivity to cold and sweet foods in the affected area. Patient is preparing for a significant life event, quotations, engagement and wedding, and desires an improved smile.
Capture that detail.
Wow. This AI is not playing. So it says PTCC. What does that stand for?
Patient chief concern.
Patient
So
chief
what-
concern, which is an exam treatment. And what is RMF? RMH.
Reviewed medical history.
Okay.
So all these things that we don't want to forget.
Right.
If we don't talk about it here, obviously it's like a reminder so that doctors can review the medical history if they have new medications and things like that.
Gotcha. And it even mentions x-rays reviewed.
Yeah.
Upper left shows a void in previous filling, all risk complications, alternatives, and benefits discussed, all questions answered. So while I was paying attention and it realized that you answered all my questions, clinical exam confirms a chipped filling on the upper left with a void catching stain, sensitivity to cold and sweet, noted gummy smile observed with disproportionate gum to tooth ratio, which you mentioned.
Oh, yes.
Which you mentioned to me because I was like, dang. I know we were playing a little scene, but I was like, Dr.
I got
Choi.
a little too clinical there.
No,
sorry.
I'm like, oh God. I'm like, should I get a
It just came
gingivectomy?
out.
No, that's perfect. And then it has the treatment plan already written out, which is number 1, replace the chipped filling on upper left. 2 is gingivectomy, recommended to reshape gum line and improve tooth height for a more natural appearance.
Great.
Laser procedure suggested for minimal discomfort. And 3, Botox discussed as a temporary option for reducing a gummy
even
smile.
Botox, okay.
Lasting 4 to 6 months. Gingivectomy preferred for long-term results. Listen, even the app isn't impressing you.
I know.
That's crazy.
I was kind of nervous for
It's
a
like,
second.
hold on, not so much. Wow. And then lastly, it has next visit, schedule filling replacement for upper left, discuss and finalize gingivectomy timeline before the patient's wedding. And 3, review treatment plan and coverage with front office team. Wow, this is great, Doc.
Awesome.
Like, I never downloaded the app because I'm not a provider, so
Anyone
I don't
can download
really use it.
Yeah.
That is crazy.
So there's a note setting there, what's called a SOAP note. It's a little more general for medical doctors, but you can even use it like, I don't know, if you're doing like a pre-interview with someone.
Oh yeah, I use that for Zoom.
And it may capture all those details.
Oh yes, we're gonna do this. I'm gonna download.
I mean, you may see little weird details about like dental things. But
because
but
it's
at
not
least
integrated. This is
captures
amazing.
the personal details.
So how do I get the app into my dental? Like, how does that
So now,
go into my dental software?
Now this note, you can get to your dental software. Now, a lot of doctors use many different software. So
Dentrix,
yes,
EagleSoft.
so many different varieties. So we can